We all know COVID-19 can be deadly, but so can government restrictions put in place to address the coronavirus. It's a topic our next guest explores in a series of research briefs for the John Locke Foundation. John Sanders is Senior Fellow in Regulatory Studies and Research Editor. His multi-part series is titled Research Warns Lockdowns and Other Restrictions Can Have Deadly Consequences. What about Coopers? Referring, of course, to Governor Roy Cooper. John, why did you decide to put together this multi-part series?
Well, I hadn't planned on it being a series, except for the more that I started writing it, the longer it got. And I thought, I can't do that to our readers. I need to break it up.
What are some of the types of things that you cover in this? Obviously, it's dealing with the consequences of having lockdowns and other restrictions. You go into some fairly fine detail about this impact.
Yes. So first I went through the research and recent findings in North Carolina about the deadly effects of lockdowns and some of the things that we're seeing in North Carolina with deaths of despair and worries about children's suicides, drug and substance abuse problems, lots of negative repercussions that we're starting to see.
And these are all the types of things that are not deaths and health problems from COVID-19 itself, but from the government reaction to COVID-19.
Yes, and a lot of researchers, physicians, economists, epidemiologists, and other experts have been warning that these sorts of unintended negative consequences are very real, and that government officials who care need to be paying attention to it.
One of the challenges that you have faced is the availability of up-to-the-minute data. We just don't have it, and North Carolina lags behind other states?
Yes, and that's been one of the ongoing problems, is while the state health officials are doing a good job keeping us up to date on COVID deaths, relatively, they are not updating deaths data reporting to the CDC, the Centers for Disease Control and Prevention, the way other states are. And when this started out, we were about 2.5 months behind, and we are now 3.5 months behind pretty much every state in the nation.
What problems does that create? I mean, some people might say, oh, well, it sounds bad, but they don't really get why it's bad. What is the problem for us being so far behind other states in reporting this data?
Why that's a problem is because the CDC uses these data. They use a statistical analysis of them to see if we are experiencing, or if any area is experiencing, what they call excess deaths. If we have so many deaths in an area that is greater than what would be expected at any particular point of time in the year, it's considered an excess death, and they consider that something statistically significantly bad is going on. Normally, that would be, in a situation like this, it would be a virus like COVID or like the really bad flu of 2018 and 19. In this case, though, looking at the research, I'm suspecting that there's more than just COVID.
So it sounds as if not having these data hinders our ability to tell just how deadly the consequences are of having these lockdowns and other restrictions.
Yes. If Governor Cooper's lockdowns and restrictions are also having a deadly consequence in North Carolina, and our data reporting is months and months and months behind, then there's nothing to warn him to say, you may want to rethink this. You may be causing greater consequences than you intend. And there's no way for him to know. There's no way for state health officials to know. And so that's the question I'm trying to answer.
Well, regardless of this lack of data, you certainly have enough data and information to put together what is at this point a 3-part series on this issue. What types of things does your research tell us about how these lockdowns and other restrictions are affecting people?
Sure. So what I am doing is I'm taking the observed number of deaths, the actual deaths that we have reported, and I can only go through September 19th. That's how far behind we are. And subtract away the known COVID deaths for the week. So, I know that, and then look at what we have left. So that gives me all of the deaths from all causes except for COVID, and I can compare that to see if we're still above that excess death threshold. And I'm seeing that is indeed the case. And furthermore, I'm seeing that we have more excess deaths, non-COVID related, than there actually are COVID deaths, which means to me that seems to ratify the research and the experts' warnings that lockdowns are having that kind of terrible consequence in North Carolina.
I want to read one line from one of the earliest parts of this series, and that is, if we are to presume Governor Cooper is issuing these orders out of concern for the health and safety of North Carolinians, we're talking about the executive orders tied to COVID-19, and that he is following the science in so doing, then why doesn't he seem the least bit concerned about the increasing warnings from scientists, physicians, economists, mental health experts, and others about the greater dangers from government lockdowns and restrictions? Sounds as if this statement is tied in to what you've just been discussing, the fact that we don't really seem to have information about these other non-COVID impacts, and there doesn't seem to be a whole lot of urgency about getting that information.
No, I wrote about this originally back in November, and since then our reporting of death data has gotten worse. But also since then, the governor has added more restrictions than he had in place before. He just recently relaxed some of them. He added the curfew. He tightened the limits on people getting together.
We had a mask mandate at some point in there.
He tightened the mask mandate and made it, he called for more snitching on people. He also reduced the hours for selling alcohol, and he put restrictions on business in general being open. So if those things were having an effect, and he had been warned about them having an effect, I just don't understand why we are still so far behind in reporting.
So we're behind in reporting. We see some evidence that these restrictions, the lockdowns, are having the same types of negative consequences that they are in other places. What do you hope happens now, having this information out there for people to review? What should we do moving forward?
Well, first of all, moving forward, I would like to see all of the governor's orders lifted and this state freed. We are starting to be surrounded by states that are free now from these sorts of illegal restrictions that are being placed by the governor. Also, I would like for the governor to acknowledge this kind of problem and try to see if that is indeed the case, that we are actually suffering more than just deaths from COVID, but excess deaths from despair and drug abuse and all these other things. So I would love to see the Emergency Management Act amended so that a single governor can definitely not unilaterally do the sorts of rulings that he has done in perpetuity. I mean, I think today was the 1-year anniversary of his declaring the state under an emergency.
So definitely a lot of things to be considered as we mark now more than 1 year since this COVID-19 pandemic first had its major impact in North Carolina. One person who's going to continue to monitor this situation is John Sanders. He is Senior Fellow in Regulatory Studies and Research Editor at the John Locke Foundation. This multi-part series has this title: Research Warns Lockdowns and Other Restrictions Can Have Deadly Consequences. What about Coopers? John, thanks so much.
Thanks, Mitch.